welcoming you to a brand new edition of Nesha Talks. This is a platform where we get to communicate with you. And please remember you can share your comments, your opinions, or even suggest the next topic for us to discuss. I'm joined by the one and only Dr. Nelson Makemba. Welcome.
Yes, thank you for having me once again on Nesha Talks, and we are going to have yet another interesting discussion.
Oh, yes.
And I'm looking forward, to the information that we are going to get into.
Thank you always, Doc. You are situated right opposite the state hospital. That easiest way to explain it. But what is the address?
Yeah, we are in Oyafa Street, RF 209, just across from Central Hospital main entrance in Windhoek North. That's where we are situated. Our contact details will be 061 220 778. That is 061 220 778. People can also go on our website, which is www.neshamedical.com, and they can find all the details there.
There we go.
Yeah.
Right in our bio. So this month, August month, Women's Month, and that's why we decided to speak about screenings for women specifically. Why is taking care of your, let's say, health as a woman very, very important?
Definitely.
Why is that, Doc?
It's important because first and foremost, mothers are the backbones of the families, So if a mom is healthy, then a home is likely going to be healthy. And also women have now entered the corporate space. We want them to be active citizens. We want them to be at work and not miss out on their work days because they are booked off ill. And also when mommy is taken care of and she's healthy, she get to live a bit longer and take care of her kids and her grandchildren. So the idea really is to make sure that, our ladies out there, they are leading a healthy lifestyle.
The backbone of the family.
Or the family.
As a woman, we also go through all the hormonal changes. That's why I also cluster it under the hormonal wellness month as well. But when it comes to being proactive, Doc, prevention is better than cure. And on this platform, we always give you information so that it doesn't happen to you. And before it might happen, what can you do? So as a woman, it's important to do screenings, Doc. But there are so many screenings. Which ones are most important and how often?
The most important one to women specifically is doing a breast evaluation. That might mean doing a breast sauna. Oftentimes when women are a bit younger, still their breast tissues are dense. So we suggest as ultrasound might be good enough. When they are at least 35 years or older, a mammogram then might become actually something that they need to consider. And by the time they get to their, 40th birthday, they can then, do it at least every 6 months. A pap smear also is advocated for. Now, the pap smear is only done in women who are sexually active for obvious reason. We can't do a pap smear if a young lady has not engaged in sexual activities yet. That then helps, especially evaluating the cervix, making sure they don't have this, human papilloma infections and picking up all the cancer cells. Blood can be taken as well that are specific to women. You can take blood to look for tumor marker or cancer markers specifically to the breast, to the ovaries, to the uterus. Those also are very important to look and to be, mindful of when one is going for a screening. And also just a general checkup that will then apply to the general population, like checking her blood pressure is very important, checking her sugar, making sure she doesn't develop issues with diabetes, making sure that her cholesterol numbers are within and she doesn't have cholesterol problems. And then to top it up, her psychological well-being is also very important. Nowadays, incorporated in part of, our practices, primarily at Nesha Medical Practice, we do often, refer our patients to see a psychologist. You don't have to be necessarily stressed out or going through a psychological turmoil. You can just have a sit down with a psychologist. It does help as well. And then, we also then encourage them to also, just knock on the dentist office and make sure that their dental issues are taken care of as well. Yeah.
A whole lot.
Yeah.
And it's important just to make sure that you're healthy, like it's doctor and the whole family is
Yeah,
healthy
it's healthy as well.
there's something called menopause. We don't want to hear it. Hormonal imbalances in primary health givers help address these issues for women that do inevitably stages.
Yeah. The idea really is to manage the symptoms, to prevent complications, and to address individual needs. Individual that comes in, especially when they are headed into the menopause, we want to address their questions that they might have. The periods become irregular, for instance. So we often do a hormonal profile, that we can do in the blood, just to make sure that, and looking into how their hormonal profiles look like. And then we then try to address specific needs. especially when they are postmenopausal and their cycle has stopped. They might have things like, they might not be able to lubricate very well, particularly when they are being intimate, and then the intimacy become a bit painful as women grow a bit older. That's something that comes up a lot in primary health consultations as well. So those are the things that we need to try and address. We have to evaluate whether is it warranted to put her on hormonal replacement therapy, maybe for a shorter period of time as she transitions as well. So those are the type of things that we tend to look at in that age group, and also just doing those other checks that we've highlighted to earlier, and encouraging them to lead an active lifestyle, reduce their weight, and maintain a desirable body weight as well, because weight has actually been demonstrated to be a problem in almost all medical issues. Anywhere you find excessive weight, any other problem can come up. And also we tend to also encourage them to actually have their consultation with the psychologist. Why? Because at this time as well, issues of depression might kick in as well. When women are postmenopausal, sometimes their bone density become a bit reduced. They develop what we call osteopenia. We then also encourage them to go for a bone density scan. That is something that we tend to see quite commonly also, especially in that space as well. And then one of the other aspects also that we tend to address, not necessarily related to menopause, is that of PCOS, for instance. It can happen in young ladies that have polycystic ovarian syndrome, and that when that happens, it might also affect their fertility. So we might put them on a fertility booster, for instance, to boost their ovulation if they are considering to fall pregnant. Individuals with PCOS tend to pick up weight; they become insulin resistant. So we often send them to a dietitian, so they are guided in how they go about preparing their food. We encourage them to exercise and reduce weight and maintain a desirable body weight, particularly the younger ones that might actually hope to fall pregnant as well. Yeah, those are some of the stuff that we tend to address in a primary health care level.
Yeah. Doc, you briefly mentioned or touched on intimacy, but let's focus on the sexual, productive system of the women. Why is it important to also focus on that specifically? And maybe some of the advice for women, especially those girls that are now, maturing and really entering into womanhood.
Yeah. The reproductive clinics that we run at the primary health care levels, will then involve, both, non and pregnant mummies. It should be a comprehensive approach. If she's pregnant, she goes to antenatal classes where she's, being taken care of through the 9 months of pregnancy, making sure that when she goes into labor, she's, delivering in a safe environment, hopefully attended to by an experienced clinician, so that the safety of the baby being born and the mom is taken care of. And then after they've delivered, which is postnatal, we also take care of that as well, making sure that her techniques to breastfeed and bond with the baby is actually at par, and she's able to do that and navigate that successfully. Part of the reproductive clinic then comes in with family planning and contraceptive issues. Before they fell pregnant, for instance, young ones maybe that, like you have highlighted earlier, entering womanhood, and maybe now they have a life partner and they want to engage in sexual activity, and they are probably not ready to fall pregnant necessarily. This is where we sit them down, we talk about all things contraceptives, the options that are there, and we also guide them into what might be a good option for them, based on their individual need at that point. So the approach is sort of tailored to the individual. And then also at the primary healthcare level, part of our reproductive, or sexual clinic that we sort of run is taking care of rape victims as well. Oftentimes, as much as it's a very sad topic to address as well, that can come up from time to time. If, unfortunately, a young lady might find herself in a position where she's raped, for instance, she come in and get evaluated, counseled, a rape kit might be pulled, evidence might be collected, and she might need to get a lot of psychological counseling and support in order for her to overcome such kind of traumas. And if she do end up in court, oftentimes we also get called to go and prevent evidence based on our findings when we made that evaluation. Yeah, so that's a setup of a sexually productive type of a clinic that you might find us running at a primary health care level.
Yeah.
Yeah.
Doc, you keep on mentioning the importance of the mental aspect, psychological as well support. What challenges do women still face up until today when it comes to the whole, psychological support, especially from family members?
Yeah, with psychological aspects, there's still a stigma attached to it. Oftentimes, particularly in our African setting, when somebody have a psychological challenge, there's still stigmatization, there's still labeling. Individuals are looked at as though they are mad, for instance, which is not necessarily the case. And also, the psyche has also, a lot to do with the hormone type of, challenges. And women, like the saying goes, they are very hormonal individuals. So that's why you probably find most of the time, it probably women that tend to present quite often with psychological challenges, and also depending on the background where they are coming from. So the idea is to always encourage, family members to become part of the journey. But by far, oftentimes, what you tend to see happening is women present all by themselves at the clinics, even though she might be a married woman, she might have a life partner. The life partner might not necessarily always come. And, for us, it has to be a collaborative effort from a primary health care provider, which is a general practitioner, with the mental health professionals, where we sort of, manage these patients among ourselves. Because sometimes just sitting in with a general practitioner and having a 15-minute consultation might not be enough. So we then have to feed them into a space, that is designed primarily to take care of mental health issues, where they can have a consultation that can run up to an hour, for instance. History is taken properly, evaluation is made, and then a very deliberate sort of tailor-made intervention is instituted. That information is fed back to us at the primary health care level, and with that, we are able to then journey with these individuals. Mm.
Well, the conversation started here, Doc. And this is one of the platforms where women can educate themselves in terms of their mental health, their physical health, especially their, reproductive health also. How do you encourage women or even caregivers and even, the health sector to empower and give all of this education to women so that they're best geared up to know what to do and what not to do?
Yeah, it's definitely the best thing with empowering women and giving them information. Number one, when they got the knowledge and the skill, they feel confident, and they feel confident in making informed decisions and taking charge of their health. So the idea really for us is to try to disseminate information as much as we can, in a simplest form that is able to be, comprehended by a layman's person. In that way, they're able to then, make a decision, from a point of being informed, and factually informed, not just, information in an abstract that, might not necessarily be, factual in a way. So we're trying to keep it simple and, to direct, our ladies so that, when they are to make a decision, the kind of, knowledge that they are making the decision from is the kind that is empowering and the one that is going to guide them into the right direction.
Great. And Doc, thank you for creating such platforms to also educate our women.
It's always a pleasure, and I'm looking forward to doing that and continuing doing that with them. Mm.
There you have it, Dr. Nelson Makemba of Nesha Medical Practice. It's empowering you so you can make informed decisions. We'll be back with our next edition.